Hello everyone! Today we're diving into an interesting topic: why blood pressure might change in both arms. Blood pressure differences between arms can sometimes be a cause for concern, but it's also quite common and often harmless. Let's explore the reasons behind this phenomenon. Before we get into the differences, let's quickly recap what blood pressure is. Blood pressure is the force exerted by circulating blood on the walls of the arteries. It's measured in millimeters of mercury, mmHg, and recorded with two numbers: systolic pressure, the pressure when your heart beats, and diastolic pressure, the pressure when your heart rests between beats. Natural variation. It's completely normal for there to be a slight difference in blood pressure readings between your arms. A difference of up to 10 mmHg is usually considered acceptable and not a cause for concern. Measurement factors: cuff size and position. Improper cuff size or incorrect positioning can cause variations. Make sure the cuff is appropriately sized and placed at the same level on both arms. Body position. Blood pressure can change based on your posture. Ensure you're sitting or lying in the same position for both measurements. Sometimes, a more significant difference in blood pressure readings between the arms can indicate underlying health issues. Peripheral artery disease, or PAD, is a condition where the arteries that supply blood to your limbs become narrowed or blocked. This can lead to different blood pressures in each arm. Another serious condition is aortic dissection, a rare but critical situation where there's a tear in the inner layer of the aorta. This can cause a significant blood pressure difference between the arms and is a medical emergency. Coarctation of the aorta is a congenital condition characterized by the narrowing of the aorta, which can lead to higher blood pressure in the arms compared to the legs. Other vascular issues such as subclavian artery stenosis, which is the narrowing of the artery near the shoulder, can also result in blood pressure differences. While slight variations are normal, you should seek medical advice if the difference between your arms is consistently more than 10 to 15 mmHg. Also, if you experience symptoms like chest pain, shortness of breath, or dizziness, it's important to consult a healthcare provider. Additionally, if you have a known history of cardiovascular disease or risk factors such as diabetes or high cholesterol, getting checked is crucial. To measure your blood pressure correctly, start by choosing the right cuff size. Ensure the cuff fits your arm correctly, as a cuff that's too small or too large can give inaccurate readings. For positioning, sit comfortably with your back supported and feet flat on the floor. Rest your arm on a table at heart level. Relax, rest for at least 5 minutes before taking a measurement. Avoid caffeine, exercise, and smoking for 30 minutes prior. Lastly, measure both arms, especially on the first visit. Use the arm with the higher reading for future measurements. In summary, slight differences in blood pressure readings between arms are common and usually not a cause for concern. However, significant differences can be a sign of underlying health issues that need medical attention. Always ensure you measure your blood pressure correctly and consult with a healthcare provider if you notice significant or consistent variations. Thank you for joining us today to learn about why blood pressure can change in both arms. Stay healthy and informed.